Hi, I'm Vicki Rogers here for OdessaConnect. I'm here today with Dr. Marc Rothman. He is the Chief Scientific Advisor for OdessaConnect. Welcome, Doctor. Good to see you. And
Thanks.
I'd like to hear a little bit about your background first, please.
Yeah, happy to. So let's say I'm a doctor. My background and training is in internal medicine, geriatrics, so older adults, and hospice and palliative medicine, which is a little bit more about the end of life and end of life care. And I live in Louisville, Kentucky, where I moved to be the Chief Medical Officer of Kindred Healthcare, a really large operator of post-acute care, long-term care services here in town. After that, I spent a year at Aspire Healthcare out of Nashville, Tennessee, where we were in people's homes at the dining room table, helping them deal with a lot of complex transitional care, post-acute care, and end-of-life care. And now I'm the Chief Medical Officer of Signify Health, which sends doctors, nurse practitioners, and PAs into about 2 million homes a year, helping do full comprehensive assessments and getting to understand where they are in their healthcare journey. So I know a little bit about trying to get into homes, try to get into the homes of older adults, and bringing some technology into that space, which is part of what got me connected with OdessaConnect.
And what is your role with Odessa?
So as the Chief Medical Advisor, what I do is I really help Todd Smith, the founder, figure out whether the technologies that they're implementing and some of the programs that they're trying to put into place really speak to the needs of older adults in their homes. And that can be a moving target. Certainly over the years since we began the journey together many years ago through the pandemic now and into 2023, the needs of older adults in their homes changes. Their desire to use technology has evolved over the last 5+ years. And the solutions that they're looking for to solve their problems has also evolved. And all of that accelerated, of course, by the pandemic. So my role is really to help him find expertise that he needs, not just me, and then customize the solutions to deliver what the older adults need.
And what led your heart, to want to get involved with Odessa?
Well, I remember the first conversation Todd and I had about that after a meeting we had gone to around something related, but not directly for OdessaConnect. And he told me about his ultimate sort of vision, which was to deliver a really easy experience for older adults to engage with digitally in the comfort of their own home. And that's a tough nut to crack, but I just fundamentally agreed with the mission. And while there are a lot of people out there and a lot of technology companies that are trying to solve a very specific problem around a specific disease, for example, or a specific symptom, Todd's view was much more holistic in that it's really about making sure the platform itself is usable and engaging. Then you can layer on all kinds of other solutions onto it. And I just really liked the way he was thinking about it back then.
Let's talk a little bit about the virtual care landscape and how it is so much different now than it was 5 years ago.
Oof. Things have really changed over the last 5 to 10 years. Virtual care could be defined in so many different ways, right? But ultimately, the way I think about it is you have older adults who are going to leverage technology in some capacity to connect with solutions, whether that's a nurse or a doctor or a device or a program, perhaps, that'll help them stay independent in their homes and manage things for them, whether they're managing healthcare directly or some of the things that we know are affiliated and associated with healthcare, but aren't quite exactly like a doctor writing a prescription.
Yes.
Right?
Yeah.
Right. The definition of what constitutes health and healthcare has really evolved. And for example, we learned in the pandemic that if you can't stock the fridge with healthy food, and you can't get a ride to your doctor's office, and you can't access your prescriptions and fill them, then you can't take care of your health. So it really runs the gamut from the doctor writing the prescription, the standard classic definition of what healthcare is, to a whole suite of services that could be provided. And a lot of it, we've proven in the last few years, can be virtual. I think there were always people who believed that. 10 years ago, I remember being in meetings when I was here at a big company here in Louisville from tech companies and various kinds of electronics manufacturers who would say, hey, we can hang this device on the wall at home, and guess what? All your patients can turn it on and put devices on themselves, and it'll just revolutionize healthcare. Well, that didn't all go as planned for them. At the same time, 90% of people who have had a telemedicine visit in the last 3 years had never had one before. They'd simply never had a digital health experience with a doctor. And now it's de rigueur, right? Lots of folks call in for virtualized nursing services. They do face-to-faces and show practitioners their rash. They take photographs and they photograph them to people. So the landscape has totally changed.
Why is it so important to get virtual care right the first time?
Oh, so that's a loaded question, right? It's really important to get virtual care right for several reasons. The first is, on the medical side, you have to do a high quality job, right? Virtual care, virtual medical care at least, cannot be of lower quality than seeing your nurse practitioner in the office.
Right.
So you have to get that right. And as a physician, that's my standard. That's my gold standard, right? If the quality's no good for healthcare on video, then you can't do it. So you got to get it right from a quality perspective. The second thing, though, is that if the experience for the person on the other end is no good, if it's too hard to connect, if the delays are too long, if the interaction itself is flippant or somehow feels not genuine, then they won't come back. And you'll have the same problems you have in the clinic, which is that they come for one visit and they don't go for testing afterwards. Yeah. Or you write a prescription for a medicine, they don't bother to pick it up. And so the same practicalities and challenges exist virtually, especially for older adults who traditionally have done in-person, in-clinic care. For them to take the leap and trust virtually, even though we know they're using the devices more than ever before, older adults have no problem accessing technology. We've proven that. But if the experience is no good, they're going to not come back the same way they're going to not come back to the clinic.
And what role could Odessa play in the virtual care industry in the future?
Well, I think of OdessaConnect as a platform. And I think that as long as they've got the ability to deliver things with good connectivity, with the right interfaces, and with the ease of use, almost any healthcare organization could use them to deliver the services they want to deliver. Whether that's going to be an in-home wellness assessment from a nurse practitioner, whether that's a consultant visit from a very specialized physician, whether that's help with navigating supplemental benefits for a health plan by a case manager. You could potentially build onto OdessaConnect almost any of those capabilities. And Todd and I have talked about other interesting capabilities that he's brainstormed over the years. As long as the platform is easy to use and provides a good experience, you can layer on just about any services that a healthcare organization would want to layer on. And each of the healthcare organizations has their own needs. Right? They're all targeting different slices of their population. They're figuring out who's at risk. They're stratifying those populations to figure out who can benefit the most from these services. And obviously not missing anybody who needs something a little bit more intense, like an emergency room. And then they know what's driving their populations to ER visits, difficult, complex, bad outcomes, whether that's in cancer or transplant or surgery. And so whatever it is they want to use the platform for, I suspect they could use it if they partnered with the organization and developed it appropriately. Okay,
now talk about the design and discovery process. I know that this was years and years of work, and you collaborated with a team of great experts. Tell us about who they are and how you all work together.
So as a geriatrician, one of the first things that I look at when someone shows me something that's going to be really great for older adults.
Does that make your eyes make your ears perk up?
No, always. I'm thrilled about it, but it's always funny because most of the ideas come from people who are not older adults.
Right. There you go. Okay.
So one of the things I do just fundamentally is I just sort of look at it and I say, is that easy for an older adult to use, knowing what I know about some of the challenges of being an older adult? So older adults have challenges with vision and hearing impairment. Older adults have challenges with balance. Older adults have challenges with motor control and sensory perception. Sometimes they have chronic diseases that affect the eyes or the hands, things like that. And so one of the first things we did was to recruit experts in the fields, neurology, rheumatology, to really vet some of what Todd was developing and say, is this easy to use in my hands if I have a tremor? Is this easy for someone to use if they have cataracts? Is it easy for someone to use if they've had a stroke and perhaps have part of their vision cut off? Things like that. And it was really great. We partnered with some academics at the Cleveland Clinic, at WashU in St. Louis. And I really think that those physicians found the process to be really interesting and exciting. They really got to contribute to something that could be of real value for older adults. And I think Todd and the team learned a lot about their basic design principles, right? How do you design things that are easy to use, simple, and effective?
And you had some challenges with your early pilots. Tell us about those challenges.
Well, they were Todd's challenges.
Okay.
They weren't necessarily mine. So an incredible amount of pilot work was done, and it was done inside assisted living facilities and nursing homes, where Todd would sit with, user groups of older adults, most of them well over 85, and he would say, use my technology. Tell me what it's like. And he was doing that at that time, if I recall correctly, he was largely using an iPad or a tablet to access the platform.
Did they like it?
Well, no, they didn't love it. They didn't love it. And it's funny because I'm not a tablet user either. And he was describing sort of their challenges holding the tablet and pushing the buttons on the tablet. Tablets are very glossy. And so there's no feedback when you press the right button.
And they're slippery.
And I find them heavy, and I think they found them heavy. And we were sitting together at one point. It's a funny story. We were sitting together. He was describing to me the pilot results. He was like, they're having trouble with the tablets. They can't figure out how they're pressing. And I remember looking up at this very large television screen that happened to be in the restaurant we were sitting in. And I said, why don't we use the television? If you're looking for a device, a digital device, and they weren't always digital, but they were becoming digital, truly digital. I said, if you're looking for a device that every older adult in America knows how to operate, is completely comfortable operating through their hand, that's already in everybody's living room. Why are we trying to get them to use another device, an unfamiliar device, when the device that they know the best is right in front of them? And by the way, the remote's on their side table, right next to where they're already sitting. And that, I guess, was a bit of a light bulb moment for Todd and for the team. And through a whole bunch of developments over the next several years, they eventually pivoted towards figuring out ways for older adults to control the television to access OdessaConnect. And it's been very successful from what I can tell.
Brilliant. Okay, so now tell me what you think is the future in 5 years. What do you see Odessa doing, and how do you see virtual care?
So I'll start with just virtual care in general. I've made some predictions about this recently because folks have come to me and asked me sort of what's on the horizon for digital health.
Have you written it? Have you written it down? Have you written a report?
Some other folks have written it down and quoted me, I think, a few times. And here's what I've said. I think we're a little bit past the bright, shiny object stage. I think what's going to happen next is a little bit of consolidation among all of these technologies, because ultimately healthcare organizations, at-risk value-based care entities who are working inside Medicare or CMMI for Medicare Innovation, they're looking for platform solutions, right? They don't want one solution for this and one solution for that and one solution for that. They don't want this device over here for one disease and this device over here and this device over here for another disease. They want a platform solution. So I think a lot of the sort of sexy, bright, shiny object phenomenon is going to dissipate a little bit. And I think there's going to be some consolidation, and platforms that can pull some of these things together, combine them all into a viable offering, are going to be successful. My hope is that that's what will happen to OdessaConnect. I do think they're on the right path, because ultimately you have to be flexible enough to provide solutions to a multitude of problems. Again, they could be medical or they could be social. We call those social determinants of health, for example. And I think that's the way ultimately they're going to move. They're going to move in the direction of helping big organizations in healthcare deliver some virtual services to a select population that improves their quality of life, reduces their dependence on getting to doctors' offices as many times as they have to, because they often have to go too many times for very low value visits that you could do virtually, and ultimately keep them from needlessly suffering inside hospitals and emergency rooms when they could actually receive care at home for a whole bunch of conditions. So that's where I'm hoping OdessaConnect goes.
And I know that there are some other virtual care platforms out there, but what makes Odessa stand out from them?
Well, first of all, I think the ease of use is critical. Everything I've now seen, there's a real tendency in a lot of digital health companies, and I understand why. Look at your phone. Your phone is infinitely more complex today than it was a decade ago. And so we tend to want to layer on and layer on. And OdessaConnect has kept itself pretty easy to use. The interface itself is, on the one hand, you could look at it and say, oh, it's pretty simple. On the other hand, you could look at it and say, it's easy to use. And so I think that's a real competitive advantage for them. Sort of the design principles that Todd has put into the system allow it to be very flexible, to integrate with all kinds of solutions, and remains easy to use. Just because you add solutions doesn't mean you need 500 more buttons to press. And he's really resisted the urge to layer on endless amounts of complexity, which for the user is critical, because what they learn how to use this year, you could adapt it a little, but you can't fundamentally change it every year. Your user community would just completely rebel. And so I think that's a competitive advantage for them.
OdessaConnect is proving to be a leader in the delivery of healthcare in the home. For more information on how Odessa can solve your organization's pain points for medical and non-medical care, visit OdessaConnect.tv.